Here's a comprehensive guide on naloxone. Cache 1. Basic drug information. Generic name, naloxone. Drug class, opioid antagonist. Drug forms. Injectable solution, IV, SC. Nasal spray, prepackaged. Auto-injector, e.g. for emergency use. Brand names. Narcan, nasal spray. Evzio auto-injector. Cloxeto, higher dose nasal spray. Definition. Naloxone is a life-saving medication used to rapidly reverse opioid overdose. It blocks or reverses the effects of opioids, including respiratory depression, sedation, and hypotension. 3. Mechanism of action. Naloxone is a competitive opioid receptor antagonist, especially at the mu-opioid receptor. It displaces opioids from these receptors, thereby reversing their toxic effects such as respiratory depression. 4. Indications. Emergency treatment of known or suspected opioid overdose. Post-operative opioid-induced respiratory depression. Opioid-induced sedation reversal. Diagnostic aid in suspected acute opioid overdose. Side 5. Contraindications. Known hypersensitivity to naloxone or any component of the formulation. 6. Before taking this medicine, precautions. Inform if you have heart problems or cardiovascular disease, history of seizures, pregnancy, or breastfeeding. Be cautious in individuals who are opioid dependent, as it may cause sudden withdrawal symptoms. Nasher 7. How to use. Nasal spray, Narcan or Cloxeto. Spray into one nostril while the person lies on their back. Repeat every 2 to 3 minutes if needed, using a new device each time. Auto-injector, Evzio, inject into the outer thigh, through clothing if necessary. Follow voice prompts on the device. Injection, healthcare setting. IV, IM, or SC by a healthcare provider. Dosage varies based on need. Dosing information, adults and children, emergency overdose. Initial dose, 0.4 to 2 milligram IV, IM, SC, every 2 to 3 minutes as needed, up to 10 milligrams. Nasal spray, 4 milligrams in one nostril. Repeat every 2 to 3 minutes as needed. Postoperative respiratory depression, 0.1 to 0.2 milligrams IV every 2 to 3 minutes as needed. Pediatrics, dose adjusted by weight, typically 0. milligram kilogram for IM-SC. 9. Miss a dose, overdose. Missed dose, not applicable for emergency use. Overdose, rare with naloxone, but may cause acute withdrawal symptoms, e.g. agitation, tachycardia, vomiting. Treatment, supportive care, symptomatic management. 10. Stop or avoid taking. Do not use naloxone routinely without medical indication. Avoid repeated use unless medically advised. Do not use in non-opioid related respiratory depression. 11. Side effects in detail. Common, nausea, vomiting, sweating, increased heart rate, tremors, nervousness or irritability. Serious, especially in opioid-dependent individuals. Severe opioid withdrawal symptoms, body aches, fever, chills, runny nose, sneezing, seizures, cardiac arrhythmias, pulmonary edema, rare. 12. Vital information. Naloxone is not a substitute for emergency medical care. Always call 911 after administering. Its effects may wear off before opioids do. Repeated doses may be necessary. Safe for use by bystanders, including non-healthcare professionals. Store at room temperature, away from light and heat. 13. Other drugs that will affect naloxone. Opioids, heroin, morphine, fentanyl, oxycodone, etc. Naloxone reverses their effects. May precipitate withdrawal if used with buprenorphine, methadone. No significant drug-drug interactions, but care should be taken in polypharmacy settings. Thank you. Have a nice day.